Hi, I'm Felicia and I'm currently documenting a heartbreaking journey through our healthcare system over the last 12 years, where I faced multiple failings and issues that have left me with a diagnostic delay of 12 years for debilitating left-sided facial pain. This particular video focuses on my experiences at York Hospital, where I experienced gaslighting and lack of transparency. In April 2022, after I returned from Scotland, my GP referred me to York Hospital to 3 departments. He referred me to ophthalmology for my left-sided periocular pain, to oral maxillofacial surgery for my left-sided facial pain, and to ENT for my ear and head pain. Oral maxillofacial surgery refused to see me. They rejected his referral because they said the case was too complex. They told him to send the referral to a named clinician at Leeds Teaching Hospital, which he did, but they too rejected the referral. This is a continued theme in my story of rejected referrals, and I just briefly want to say that whilst it's difficult for me, it's a very difficult position that the GP gets put in, because their jurisdiction of the general practitioner ends when they press the referral button, and if it's sent back with no conclusion, they're left to deal with the case when they don't have the specialist skills to deal with it. ENT agreed to see me, and I saw ENT in July 2022, and the ENT surgeon or consultant said that he was going to get to the bottom of my problem, and like all the others said he would do the scans and get me back to find a way forward. He sent me for an MRI neck and a CT neck, which I had in July 2022. I received a letter from him 2 weeks after the scans saying that they had found some abnormality in my retromolar and buccal fat pad region. He told me that he was sending that my problem couldn't be dealt with by ENT and that it was an oral maxillofacial problem. And because York wouldn't see me, that he had sent the case and the scans up to James Cook Hospital to the oral maxfax team there, who sent it back to him and said, "You deal with it, you found the abnormality." It was like a game of tennis. It was sent back and forth between these two trusts for about 4 months, both of them refusing to take responsibility for the problem. I did ask the ENT surgeon or consultant about my head pain, and he thought that it may be caused by an enlarged temporal bone, but he gave me no more answers. I saw ophthalmology 4 months later, and I showed the ophthalmologist some of the images that had been taken and done at York Hospital. I showed him the image of my small left eye and the image of the swelling around the temporal region, and I asked him if it could be temporal arteritis. I told him that the pain was getting worse in this area, and he dismissed it and said, no, it's not temporal arteritis, and that the scans weren't accurate, that it was just the angle of the scan. They keep saying this. I asked him what it could be, and he said the issue is with the tissue, which indicated that he understands and knows that this is a problem with my soft tissue. But again, he took no action. He left me with no care options, no treatment plan. The letter said treatment nil. He did, however, acknowledge that the scan that was found with the abnormality needed dealing with, and he wrote to oral maxillofacial surgery at the hospital and said, could they see me? And they finally agreed to see me at oral maxfax at York. I went to see the oral maxillofacial surgeon in February 2023. And what ensued was horrific. He didn't tell me or explain the abnormal scan. That's still not being explained. I showed him some of the images from that MRI scan. And I told him that in those areas of white, that's where I had the pain. He said to me, it's coincidence that you're seeing that. You're choosing to see that, he said. I then showed him an image of where the white around my eye connects right down to my jaw area, which is where I have this connected pain. And I tried to explain that to him. And he got the image up on his computer and he proceeded to Photoshop it so that all of that white showed on the other side. And he said to me, look, Felicia, I can do it. I can make it come up on the other side too. It was like sitting next to Paul Daniels. And for anyone who's not in the UK, Paul Daniels was a very skilled magician. I then showed him some of the CT images from NHS Lothian and asked him to explain the asymmetry in my face. And he responded by saying to me, the quality of your iPad is shit. That's what he said. It wasn't just rude, it was gaslighting, and that went on for 3 hours. Gaslighting is when someone uses their power to manipulate your reality so that you think you're losing your mind. Well, I came out of that consultation thinking, I thought I had lost my mind. I was in a really, really bad way. I felt powerless, I felt frightened, and I felt threatened. And I decided after that I wasn't going to return for the follow-up, and I wasn't going to go to any more consultations and be bullied and gaslighted in this way, because the impact on my mental health was way too serious. What I've just explained to you is in a sequence of events is what I have been dealing with for 12 years in our NHS. Referrals refused for no reason, or I'm seen once, promised the world, and then a letter plops through my letterbox saying that I've been discharged or it's been sent to another hospital. And if they find an abnormality, they either gaslight me, tell me I'm imagining it, or again, just shut it down and take no action. And this is the cause of my delayed diagnosis of now 12 years. The impact of all this on me, not just living with physical pain, but living with worsening pain and being silenced and invalidated, is a really, really, really frightening combination. You just feel powerless. I want to address York Hospital directly now, because I can't return to your hospital because that incident with that consultant was too threatening and too dangerous. But I am left with unanswered questions that I am asking if you'll please answer. I would like to remind you that good medical practice states that a doctor must answer questions honestly, and you must give patients the information they want and need in a way they can understand. So here are my questions. What was that abnormality? And has the infection now spread and damaged my pyrogoid muscle and the buccal fat pad, because the abnormality states that it's extended to there now? Could my head pain be temporal bone enlargement, as the ENT consultant says? If this isn't temporal arteritis, then what is this pain in my temporal region? And what is that swelling at the left side of my head in those images? I have severe pain around the left side of my eyebrow just above, and in the images I can see that the frontal lobe is bigger on this side. So I'm asking, could this be neuroinflammation, this pain here? And lastly, I've got a trickle on the left side of my lung on this side, and I've seen in the images that on the left side there are dense white patches that aren't on the right side. And I'm wondering if this infection has possibly spread down to the left side of my lung now. I'm asking if you'll please answer those questions for me. I lastly just want to end by saying that this lack of transparency that I've experienced at York Hospital and the gaslighting is a systemic issue which must be challenged. Transparency in healthcare is essential to achieve patient safety. Patient safety starts with transparency, and leaving an abnormal scan when a patient is in absolute agony is not patient safety. And this must be at the top of the healthcare agenda, to bring transparency to the forefront of our healthcare system. Gaslighting and lack of transparency are dangerous, and they leave patients with extreme confusion and anxiety. I'd lastly like to reiterate if York Hospital can please come forward and answer these questions. Thank you very much for watching.